Today, we're diving into a medical mystery that a whole lot of people face, that nagging pain or maybe numbness in your hand. Now, you might immediately think it's a wrist problem, right? But what if I told you the real culprit is actually hiding somewhere else entirely? Let's start the investigation. You know that feeling you wake up in the middle of the night and your fingers are totally numb, or you get that tingling pain in your hand when you're trying to work? It's super common, but figuring out why it's happening is a huge challenge because the source of the problem might be way up the line from where you're actually feeling it.
So, let's treat this exactly like a detective case. When it comes to this kind of hand pain, we've got two primary suspects. Our job is to figure out which one is the real source. Is the problem right there in the wrist, or does it actually start all the way up in the neck?
Okay, let's meet our suspects. First up, the usual one, carpal tunnel syndrome, or CTS for short. This is the classic case, a compressed nerve right there in the wrist. Our second suspect is a cervical spine disorder, which is really just a fancy way of saying a pinched nerve in your neck. Now, both are really common, but they need completely different game plans to fix.
And this is the absolute core of our mystery. Both of these conditions can show up with nearly identical symptoms in your hand. It's this tricky overlap that makes it so hard to figure out what's going on. And getting it wrong can lead to treatments that just don't work, or even unnecessary surgeries. So getting it right is absolutely crucial.
So where does any good detective start an investigation? Well, you talk to the witness, and in this case, the witness is you. The clues, they're your symptoms. Your story is the first, and honestly, the most important step in cracking this case.
A really thorough clinical history is kind of like the first round of questioning. By just listening carefully to the details, like when do the symptoms pop up, what makes them worse, what makes them better, a doctor can start to build a really strong case for one suspect over the other.
And this is where the clues start to get really interesting. A key study from 2005 found some pretty dramatic differences in what patients were reporting. So take a look at this. 84%, that's huge. 84% of carpal tunnel patients said they get numbness at night. Only 10% with a neck issue said the same. And that makes sense, right? Because when you're sleeping, you can get fluid buildup in the wrist that puts extra pressure on that nerve. Now flip that. Look at the bottom line. 76% of people with a neck problem actually felt, well, neck pain. Shocker, I know. But only 14% of carpal tunnel patients did. These numbers give us powerful first clues that can point the whole investigation in the right direction.
All right, after the witness interview, it is time to gather some physical evidence. This means doing specific tests that are actually designed to provoke the symptoms and basically get a confession from the real source of the problem. Let's see how doctors do it.
For carpal tunnel, there's a really simple but effective test called the hand elevation test. You just raise the hand, and that alone can bring on those familiar symptoms. For a suspected neck issue, clinicians might use something called the Sperling's test, which involves very specific neck movements. Now, this one has high specificity, which is just a technical way of saying that if the test is positive, there's a really good chance the neck is in fact our culprit.
But, and this is a big but, here's a crucial point. A big review from 2023 really emphasized this. You can't just rely on one of these tests. They found that a lot of the studies on these tests had a pretty high risk of bias. The takeaway? A single test just isn't enough. They're all just pieces of a much bigger puzzle.
Okay, so when the physical evidence isn't quite enough to close the case, where do detectives go next? To the forensics lab, of course. And for our investigation, that means using some pretty advanced imaging to get a direct look at the crime scene.
We're talking about high-tech tools like ultrasound and MRI. These things let us actually see the nerves themselves. The whole point is to find hard, visual proof of compression, whether it's happening in the wrist or somewhere up around the spine and the neck.
And this just shows you the power of ultrasound perfectly. On the left, you're looking at a nice, normal median nerve. But on the right, in the wrist with carpal tunnel, you can clearly see that nerve is enlarged, it's swollen. That is our smoking gun for CTS. It's direct visual confirmation of the problem.
And then you've got MRI, which takes the investigation to a whole other level. It can actually see tiny microstructural changes in the nerves themselves. It gives you these incredible high-def pictures of the carpal tunnel. And most importantly, it can pinpoint the exact spot of any compression in the neck, showing us precisely where that nerve is getting pinched. But what if we need more than just a picture? What if we need to know exactly how well the nerve is actually working? For the most direct, definitive evidence, investigators can turn to what is essentially a wiretap on the nerves themselves.
This is done with something called electrodiagnostic testing. Think of your nerve like a highway for electrical signals. These tests measure how fast and how strong those signals are moving. So if there's a traffic jam somewhere because of compression, the signal is going to be slow or weak, and that tells us exactly where the problem is.
So here's what that wiretap actually looks like on a screen. On the bottom, you can see the signal from a healthy nerve. It's a nice, strong, fast peak. Now look at the top graph, from the affected side. See how that wave is smaller and kind of shifted over to the right? That's a visible delay. It's the absolute telltale sign of compression, proving that the nerve signal is being slowed down.
And just how reliable is this piece of evidence? Well, for carpal tunnel syndrome, the American Association of Neuromuscular and Electrodiagnostic Medicine says these tests have a specificity of over 95%. That is an incredibly high level of certainty. It makes this a real cornerstone for diagnosis, especially when things are murky.
Okay, we have interviewed the witness, we've gathered physical evidence, we've analyzed the forensics, and we've listened in on the wiretap. Now it's time to bring all these clues together and deliver the final verdict.
So what is the single most important thing to take away from all of this? The research is overwhelmingly clear on this one point. There is no single magic test. You just can't rely on one piece of evidence, no matter how convincing it might seem on its own.
The real solution to the case is following this pathway. It's a comprehensive approach that brings together every single stage of our investigation. You start by listening to the story, you use the physical tests to find clues, you get visual proof by analyzing the crime scene with imaging, and then you confirm how the nerve is working with the wiretap.
And that's really the final verdict in our case. That aha moment doesn't come from finding one perfect clue. It comes from seeing how every single piece of evidence, from your own story all the way to these high-tech tests, points to the exact same conclusion.
And this brings us to one last thought. We've seen how combining all these different tools is the key right now. But as technology like MRI and ultrasound gets even sharper, and as our tests become even more precise, are we going to get to a point where this kind of diagnostic dilemma isn't a dilemma at all? You know, maybe one day the whole idea of an unsolved case of hand pain will really become a thing of the past. Thanks for joining us.